Hello everyone, welcome back to Sowkya Vision. Today we are going to discuss the radial nerve. In the last class we have completed median nerve. Today we are going to complete with radial nerve. The root value of brachial plexus is what? It is formed by the roots of C5, C6, C7, C8 and T1. Yes, the radial nerve is also formed by the main roots that are C5, C6, C7, C8 and T1. Yes, it is going to form in the axillary region. Yes, it is going to form in the axillary region. After forming, it is entering into the intermuscular space. Yes, here it is formed. It is entered into the intermuscular space. Intermuscular space along with a branch of brachial artery is known as profundus brachii. It is a branch of brachial artery. So, the radial nerve along with the profunda brachii entering the intermuscular space. The intermuscular space bounded by shaft of humerus, long head of triceps brachii and the lower border of teres major. Yes, it is going to enter intermuscular space and from there it is going to enter the posterior surface of the humerus. From the intermuscular space it is going to enter the posterior surface of the shaft where it contains the spiral groove. Yes, it contains spiral groove. In the spiral groove, it is presented along with profunda brachii. The radial nerve and profunda brachii are present in the spiral groove or the radial groove. So, after crossing the spiral groove, it again enter anteriorly. Yes, it again crosses anteriorly. In the radial groove, it is going to supply the lateral head of triceps to the medial head of triceps. Before entering the spiral groove, it gives a branch to long head of triceps. Yes, it is going to give long head of triceps. After entering the radial spiral groove, it is entering into the head, lateral head of triceps and medial head of triceps. And also it is going to give branch to the anconeus. It is going to give branch to the anconeus muscle. Yes, and it is also giving a cutaneous branch. In the radial groove, it is going to give a cutaneous branch which is divided into again posterior cutaneous of arm and posterior cutaneous of forearm. It is going to supply the complete posterior aspect of the upper limb. Yes, the cutaneous branch is dividing into posterior cutaneous of arm and posterior cutaneous of forearm. So, after leaving the spiral groove, it is entering anteriorly. Again, it's coming anteriorly, crossing lateral epicondyle. Yes, crossing lateral epicondyle. There it supplies to brachioradialis, a part of brachioradialis and brachialis and extensor carpi radialis longus. Yes, when it is crossing the lateral epicondyle, it is going to supply to brachioradialis, extensor carpi radialis longus and brachialis muscle. Yes, and it is entering into the forearm region. Up to here it is arm region. Yes, it is entering into the forearm region. When it is entering into the forearm region, at the lateral epicondyle, it is going to divide into the superficial branch and the deep branches of the radial nerve. The superficial branch is sensory. Yes, the superficial branch is completely sensory that crosses anatomical snuff box and enter the dorsum of the hand. Yes, it is completely sensory that supplies posterior surface of the arm, forearm and lateral part of dorsum of hand. Yes, now the deep branch is going to cross. Yes, the deep branch is going to cross the supinator muscle. From lateral, it is going to cross medially. After crossing supinator, where it supplies to the supinator muscle, it supplies to the supinator and entering the interosseous membrane. This is the interosseous membrane. The blue color shaded part is the interosseous membrane. It crosses interosseous membrane and enters the dorsum of hand, where it supplies extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus and extensor indicis. Yes, These are the muscles that are going to supplied by the deep branch of radial nerve. Once it is entering into the radial, once it is entering into the hand region, it enters the dorsum of the hand and it supplies lateral two-thirds of the dorsum of hand, that too cutaneously, that is the sensory part. So what are the muscles it is supplied? It is supplied, motor supplied to the triceps brachii, anconeus, brachialis, brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis supinator, extensor digitorum, extensor digiti minimi, extensor indicis, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis. These are the muscles that giving motor supply by the deep branch of radial nerve. Now the cutaneous surface supply. The cutaneous supply by radial nerve is the complete posterior aspect of the upper limb. Yes, the posterior surface of the arm and forearm and lateral two-third of dorsum of the hand. Yes, lateral two-third. That means here, this is the lateral part. This is a lateral part. Lateral part is lateral part of dorsum of the hand. Yes, this is complete discussion of radial nerve. If you have any doubt, please comment in the comment section. Like the video, share the video with your friends, subscribe to the channel. Namaste.